Hey, thanks for joining me today. Running through an overview of the Medicare Part D program, which is the prescription drug program. My name is Mike Level, founder of AskMedicareMike.com, independent agent that can help you here in Wisconsin as well as several other states. So we're going to get started with the basics. Part D is Medicare prescription drug program. Its plans are sold by insurance companies. Monthly premium can vary by plan, and they all must meet the same basic structure as far as the minimum guidelines. So Medicare sets these guidelines and they must be at least that good. They are set on a calendar year basis, so plans can change from year to year. In order to get those plans, you must live in that service area in order to be able to get that specific plan. And all plans have a formulary, which is really just a fancy way of saying these are the list of medications that we cover. Now that list is typically broken down into tiers. 5 is the most common. 1's going to be your lowest cost as far as filling that prescription. Oftentimes you see this is made up of like preferred generics, and then it goes up from there with 5 typically being the most expensive. A lot of times this is like specialty medications. Oral chemo is a common one that falls into there. Now all plans have 4 stages. The first stage is your deductible stage. This means basically you're responsible for the coverage until you reach that deductible. Now, some plans have exceptions where they will have coverage for certain tiers, maybe 1 or 2, for example, which is going to be before deductible, so you don't have to meet that. Or they might have a smaller deductible than the maximum allowed amount for 2020, which is $435. Now, after that deductible is met, you fall into the initial coverage stage. This is where your costs are going to be basically outlined on that enrollment booklet, the summary of benefits, where it splits out your costs for the different tiers. This is where it's going to follow those accordingly. Now you're in this initial coverage stage until or if you reach the coverage gap, which has also been referred to as the donut hole. Now you're in the donut hole, your costs are going to be 25% of the medications in most cases until you reach catastrophic coverage, or if you reach catastrophic coverage, at which point your costs are going to be greater of 5% of the cost of the medication, or $8.95 for a brand, or $3.60 for a generic, whichever is more expensive. Now, not everyone goes through all of these stages in a year, in any year at all. So it's important to understand how you move from stage to stage. And the way you do that is by looking at basically the 2 buckets of costs, which are the 2 main ways that Medicare follows your prescription costs. So there's 2 buckets. There's your bucket, which is included in the money that's applied to your deductible, the money that you spend filling your prescriptions that are covered, and manufacturer discount, which can be important, as you'll see here in a moment. The other bucket is the combined bucket. This is going to be all of your costs plus what the plan, the insurance company, pays. So an example of how this works is, let's say you have a medication that costs $200. Your copay is $50. So your copay goes into your bucket, which is $50. $200 though is the total cost between what you're paying and what the insurance company's paying. So $200 goes into that second bucket. So if we look at the stages, you move into the coverage gap by that combined bucket, that total bucket, reaching a total dollar amount of $4,020 for the calendar year. Now you stay in that coverage gap level until your bucket reaches $6,350. And that's how you'd move from stage to stage. Like I said, not everyone meets all of these different stages throughout the year, but it's important to understand how you could. Now, all plans have a network of pharmacies. These are pharmacies that you can use to get your prescriptions filled. Now, in addition to just having a list, many of them have preferred pharmacies. It's important to know that because if you fill your prescriptions at a preferred pharmacy versus a standard one, you could have a lower cost of filling that prescription, sometimes significantly lower. A third option a lot of times is a mail order. And this can often be the least expensive way of filling your prescriptions, is using a 90-day mail order if they have a preferred mail order vendor. Many companies do. Now, not everyone applies or qualifies for extra help, but it's important to understand that the program is out there because if you do qualify, it can be really beneficial. Helps pay for your monthly premium, different some of it or all of it, depending on what your level you qualify for, as well as the cost of filling your prescriptions. Eligibility is based off of a combination of income and assets, which you can see there on the screen as far as what those numbers are. If you're not sure how to apply, or if you do qualify, reach out to me and be happy to help. Creditable coverage, this is something that I want to bring up because a lot of times I get questions from people who are saying, I'm not taking any medications. I don't want to pay extra for a drug plan. And I understand where you're coming from. I get you. As long as you understand what those potential consequences are. Because if you do not take a drug plan and you do not have creditable coverage, if you do decide to sign up later, you could have a late enrollment penalty. And that penalty adds up. It's 1% of the average cost of the nationwide Part D plan for each month that you don't have coverage. So if you go a full year without having coverage, that means it's 12 months, 12% added. And it's not a one-time fee or penalty. It's you pay that each month as long as you continue to have prescription drug coverage. Now on the left-hand side, there's some options there for people that you might see as far as what qualifies or can qualify for creditable coverage. VA coverage, Wisconsin Senior Care if you're here in Wisconsin, and some employer plans also qualify. It's important to check with HR to make sure and verify that that does. Plans can have restrictions. It's important to know what those restrictions are. That way you can make a good decision when you're choosing your plan up front and not be surprised later. So one possible restriction is a formulary, a list of medications. It doesn't do you any good at all to have the lowest premium plan if it doesn't actually cover your medications that you need filled. Step therapy is another one. That's where basically your medication might be on the formulary, but the insurance company wants you to try a less expensive option first, see if that works for you. And if it doesn't, then they'll step up into that next medication. Sometimes it's one step, sometimes it's multiple, but that can be a way of restricting where you can't get the medication that you want filled right away. Prior authorization, this is where typically your doctor needs to fill out some extra paperwork for the insurance company, stating that you really do need that prescription and why you need it, beyond just writing a prescription in order to get that filled. Quantity limit, this is something where I see it a lot of times with heavy duty painkillers or other medications where you can still get the medication as much as you need, but you have to fill it more often. So you might only be able to get a certain amount where you couldn't get a whole 90-day supply out at once because they don't want you to have that at home. So you have to fill that more often, maybe weekly, every 2 weeks, or every month, depending on the medication and that restriction. Some common questions that come up is a standalone Part D plan, same coverage as the prescription coverage included in a Medicare Advantage plan. And basically, if your Medicare Advantage plan has prescription drug coverage included, which many of them do, then it has to follow that same basic template and meet those minimum guidelines that Medicare set forth. When can you change plans? In general, after you initially choose one, you can change every year during the annual enrollment period, which is October 15th to the 7th. Outside of that, you'd really need typically a special reason to change, which you may qualify for, but they're not as common. So reach out to me if you're curious if you do qualify for one. But in general, I tell people plan on the annual enrollment period as your opportunity to make a change. Why am I doing this? How much do I charge? I do not charge you a fee for my time or services. I am compensated from the insurance company. If you enroll through me, you don't pay anything extra for the plan for using an agent like myself to help guide you through this process, because the premiums are set regardless of how you enroll. And if you do enroll with me, you can call me with questions. I'll help guide you through the process, both initially as well as moving forward. After you have questions, anything comes up, you just reach out to me. A couple tips for you. Wisconsin Senior Care. It's a unique program only for Wisconsin residents 65 and older. It can be a useful program as an alternative to Part D or in addition to Part D, depending on your income and what you need covered. Also, there's discount options. GoodRx is a common one. I will look up medications for people, and sometimes I can actually get it filled for less expensive on using GoodRx coupon than I can on a Part D program. Not always the case, but something to check into just to confirm. Medicare.gov is a useful tool as long as you know how to navigate the site and get to what you're looking for. It can be confusing for a lot of people, and you have to make sure you're using it properly to get the right info from it. And that's where sometimes contacting an independent agent like myself to get you through this process, getting you coverage for the prescriptions that you need covered in as least expensive way possible, can be a useful option. So again, my name's Mike Level. I'm an independent agent, been licensed since 2009, so quite a while now. You can reach me directly, 608-571-4461. Mike at askmedicaremike.com. That is my website. I'm the founder of MedicareMike.com. You can reach me there.